All right, y'all, welcome back to Level the Playing Field. Today, we're going to talk about the relationship between your doctor and insurance companies. We're going to keep it pretty bland, not too contentious, just get into the basics. Like and subscribe for more content just like this. Let's get it. So, most people are getting their insurance through their job, through their employer, right? And the concept of healthcare insurance, like any other insurance, is effectively you're paying on the front end, anticipating that something may happen later. All right, so a bit of money is coming out of your paycheck and your employer likely is helping pay for part of that too, right? And the idea is now you're covered should you need something healthcare wise throughout the year, okay? And so healthcare insurance companies and medical providers do a lot of negotiations. There's a lot of interaction, right? Because most people who go to the doctor are not paying for most of their care themselves. They're using their insurance to help pay for it. And so you might imagine, just like everything in life is business, right? There are negotiations that happen on the back end. So if you go to a certain medical provider, hospital, a private practice, whichever provider you see, right? That provider or that group of doctors or providers, they negotiate with healthcare insurance on the back end. And basically what they're negotiating is what they're going to allow or what they're going to charge, right? What you're going to end up paying or the insurance company will end up paying. And now, as you've probably seen, you may have healthcare insurance, but you still get a bill, right? Every healthcare plan has different stipulations about what you're going to pay versus what they're going to pay. And that can change throughout time. You've probably seen the term deductible a lot. And the deductible really effectively is how much you need to pay out of pocket yourself as the patient before your healthcare insurance will kick in. So when someone says they have a high deductible plan, a high deductible healthcare plan, what they're saying is there's a high amount that they're going to have to pay before healthcare insurance really kicks in. So what you'll see is at the beginning of a year, usually the calendar year, most people have, a high deductible, right? So they haven't used much healthcare. And so anything they need is going to be effectively paid for themselves in a large bit. As they go throughout the year, as they kind of accumulate healthcare payments, right, they pay up and they reach that deductible. And so you get to the end of the year and a lot of people are trying to get their healthcare taken care of because they hit that deductible. So now their healthcare costs a whole lot less to them because at that point, insurance is going to end up paying most or maybe all of what they need when it comes to it. So us as physicians, we often see an end of the year rush when it comes to treatment. So people who might have something they might want taken care of that wasn't an emergency, like a surgery that didn't need to be done ASAP right now, they may wait closer to the end of the year after the deductible has been hit. And so what we see is this huge rush. October, November, December, everyone wants to come in and take care of everything they have. And that's a crazy time for us as doctors. But going back to the negotiations. So in a specific situation, right, a doctor's group or physician's group have people who effectively work with insurance, negotiate back and forth with them about the terms of what's going to be taken care of and how it's going to be paid for. And every group of physicians has a different set of contracts with every single insurance payer. So, there's different payers, there's Blue Cross Blue Shield, there's Aetna, there's what have you, right? Every single physician's group, every group of doctors or hospital has different contracts with each single one of those. So you can see how that gets confusing and extensive pretty quickly. Most provider groups have someone who's dedicated, or really a whole team who's dedicated to that whole process. So here's where things get contentious in some situations, right? Because there's a bit of a push and pull between the provider and the insurance company. The provider, of course, physicians like myself, our goal is to provide treatment. You come to me, you've torn your ACL, or maybe I suspect you tore your ACL, okay? I suspect you tore your ACL. The way I confirm that is by getting an MRI. An MRI shows soft tissue better than an X-ray, right? Now, an MRI is more expensive than an X-ray. So your insurance is asking itself, well, is this MRI really necessary, right? They're trying to make that determination because they're trying to pay for or be as cost conscious as possible, right? To save money on their end, right? And that's where the push and pull oftentimes comes in between doctors and insurance companies. So what happens is when I see a patient who I think might need an MRI to look for an ACL, right? I write my doctor's note at the end, the note you can see written in your chart, right? That chart gets sent off to insurance. Insurance reviews that and they decide yes or no, we agree with this and we agree to pay for this, right? So many of y'all have probably gotten letters in the mail, that say denial from an insurance company after you and your doctor have come up with a plan. You schedule the MRI, you schedule something, right? But then insurance denies it. And that occurs when insurance has determined that they don't feel like whatever we discuss is necessary at this time. And each insurance company actually has a set of guidelines that they say, these are the things you must have done, or these are the things that must have occurred for us to feel like we're gonna pay for this, right? That doesn't always correspond with what I think as a doctor. So in the case of the ACL with the MRI, right? I'm trying to show or demonstrate to your insurance that, hey, this person had a recent acute injury. We need to figure out what's going on now because we need to get to it now if that's the case, right? And so I'm trying to defend that when I write my note about you, when I send it off to insurance to try and get them to pay for it, right? So that's where the back and forth comes in. Another thing that comes in that can be kind of confusing and or frustrating for patients is this concept of pre-authorization. Pre-authorization is something that many insurance companies will reserve for more expensive treatments or like imaging studies, diagnostic studies. It frequently occurs when it has to do with drugs that are more expensive, and certainly surgery, surgery is the most expensive treatment pretty much that you can get as a patient. So pre-authorization is once again effectively the provider trying to prove or demonstrate to their insurance before the treatment is done that this is necessary to be done. So again, if we take something like an ACL tear, okay? Let's say I've gotten an MRI on the patient, confirmed it's true, you tore your ACL. This is maybe someone who's young and athletic and their plan is to go back to playing sport. Me and the patient would have a discussion about their goals, right? What do you want to do? Where you want to get to? Does it make sense to have surgery to fix this ACL, right? Now let's say we come to that conclusion together. I then submit that information to insurance to get that pre-authorization, basically that authorization saying that this makes sense and we're going to allow you to proceed, or we'll agree to pay for it at the very least. Insurance can't tell you what to do. They can just not pay for it. You as a patient can say, I'm going to pay for it out of pocket, but usually that's too expensive for anyone to do. So that pre-authorization process can be frustrating to patients because for one thing, it's not instant, okay? It takes, it can take weeks sometimes to get that full authorization. So it means you can't always get what you feel like we need to do ASAP right away. That process takes time. Now, where things have gotten contentious is that there have been situations when people have felt like their care was delayed because of the pre-authorization process. Again, remembering that kind of dichotomy is between the provider and the insurance company, wherein the insurance company is incentivized, or their goal is to keep costs down, right? And only do things that are necessary as it pertains to medicine, right? But the provider is trying to take care of you and get you exactly what they feel like you need. And that may not always line up. And that's where things become contentious. Now, people ask questions about things like out-of-network versus in-network benefits, right? So a doctor might be in-network for you. Someone may have another insurance plan, and that doctor is out-of-network. And the question is, why can't I just see whatever doctor I want to see? Well, again, you can, but it may become cost prohibitive, right? So what determines if a doctor is in network or out network, again, goes back to that kind of back end negotiations, right? Certain physicians groups will have negotiations with certain insurance payers, and they will determine that, hey, we're going to work together based on the terms we've determined, or it may be decided that, hey, look, our goals don't match up and we're not going to work together, in which case that provider, that doctor will be out of network for that insurance. Now, some insurance plans will give you out-of-network benefits, such that if you choose a doctor or a provider who's out-of-network, we'll still cover an aspect of it, but it may be more expensive for you. But then some insurance plans, there will be no coverage for that, and they'll say, hey, look, you're gonna be paying most, or not, if not all of this, if you wanna see this doctor who's out-of-network. And so that can be frustrating, right? To either be trying to seek care from someone you feel like you wanna see, a doctor you wanna see, and then to find out they're out of network and it's not gonna make sense financially, but that's why that happens. It really comes back to, again, the negotiations at a higher level between the group of doctors or the hospital involved and the insurance payer. So I know this is a rocky road and a difficult thing to navigate, and I hope some of these pieces help to elucidate or bring light onto kind of the pieces of what makes insurance and provider relationships difficult and how that can affect you as a patient.